So good evening, everyone. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset. Welcome to the second of a two-part webinar series on mental health in high school, presented in collaboration with the Somerset Healthcare Foundation's Youth Board and Friends Health Connection. Our topic for tonight's webinar is What is Mental Health Care? Talking about depression, school-related anxiety, and isolation. The teenage years can be a stressful time. During adolescence, bodies and brains are going through significant changes. At the same time, teens are coping with tough academic schedules, trying to fit in socially and meeting expectations from parents and teachers. In some cases, feelings of anxiety and depression can lead to more than just typical teenage stress. During tonight's webinar, we will learn more about feelings of depression, anxiety, and isolation that teenagers face, the difference between normal teenage angst and a serious mental health issue, and how to seek help. We are joined this evening by Kathleen Haughey-Eannone, a certified psychiatric nurse with more than 20 years of nursing experience in the mental health field. Kathleen serves as the director of Robert Wood Johnson University Hospital Somerset's Eating Disorders Program. Our panelists also include two members of the Somerset Healthcare Foundation's Youth Board, Juliet Nolt, a student at Ridge High School, and Michelle Lee, a student at the Pingry School. So thank you all for joining us this evening. We will begin with a moderated discussion with our three guests, and then we will open it up to questions and answers from our audience. Should you have a question for any one of our panelists, please place your question in the Q&A section of the webinar. So why don't we start off by having each of you tell the audience a little bit about yourself. So we'll start with Kathleen and then go to Michelle and Juliet. So Kathleen.
Hi, thank you, Serena. So I've been a nurse for just about 23 years. I am a certified psychiatric nurse. As Serena said, I'm the director of the Eating Disorders Program here at Robert Wood Johnson Somerset, as well as the adult outpatient services for Robert Wood Johnson.
Thank you so much. Juliet?
Hello, my name is Juliet. I am a student. I just finished up my senior year at Ridge High School, so I'll be attending college in the fall. I'm a member of the Somerset Healthcare Foundation Youth Board, which is in association with the Robert Wood Johnson Hospital System. And I also volunteered at the Robert Wood Johnson Somerset location. So that is my experience.
Thank you so much for joining us. And Michelle.
Hi, I'm Michelle. I'm a rising senior at the Pingry School. And I'm also on the Somerset Healthcare Foundation Youth Board. This will be my second year, and I'll also be co-chairperson this year.
Great. Well, thank you again for joining us. So, Kathleen, why don't we start by giving our audience kind of a overview of the stressors you see in teenagers, and how can you tell what the difference is between what is normal and what is really a serious, mental health issue?
Sure. So, I think it's important to, note that we're in the middle of the pandemic. So there's no question that COVID has exacerbated things that we've seen in the adult as well as the teenage population with regards to being able to manage anxiety and stressors and depression at home. So, with the added stresses of trying to do this hybrid learning between online school and school in person, and or all online school, and trying to manage getting everything done to be able to progress in, the schools with regard to your grades, and or fears around being able to meet requirements for graduation, I think has exacerbated things that are normal stressors that children face. Everybody kind of has a threshold of stress that they're used to dealing with, whether it's at school or work. There's a normal level of stress that people work under with deadlines, things that we are managing with regard to work and home and social commitments that we manage day to day, that there's sometimes, stress on you and you feel it, but, you're able to put that down and put it aside and relax on the other side. Where stressors become concerning is when they start to affect your ability to function in your everyday lives. So patients who come in that have extreme stress that is starting to develop into, let's say, an anxiety disorder, start to describe things as GI complications or difficulty sleeping, or the classic sign of anxiety that someone describes. They feel like they have something sitting on their chest, or they feel like they're actually having a, quote unquote heart attack. It's a very prominent feeling of tightness and heaviness in the chest. It affects really every organ system and the ability to function normally in your day-to-day life. So when you start to see those signs and symptoms in yourself or in a friend or a loved one, that they're putting that much on themselves, that they're starting to have physical manifestations, obviously that's a time where you would want to reach out for some assistance.
Well, thank you for explaining that for us. So you brought up the pandemic. So has the COVID-19 pandemic led to more teens feeling anxious, depressed, or isolated?
Well, yes, isolated, definitely. There's no question. Humans are a social creature. We thrive in community, and we thrive in family systems and friend systems. We go to school to create social connections. We go to work to create social connections. And the pandemic forced all of us to take a step back and isolate. And what that did create was situations where perhaps people were prone to maybe some anxiety disorders or depression or other mental health issues. That forced isolation did bring about increased surge, let's say a surge of mental health issues for people that normally didn't necessarily have them before. Isolation is very detrimental to the human psyche, to use that term. Again, we're social creatures. We need to be able to reach out and make connections. And when people are forced into being at home alone, or, even with family members that, let's say, they don't get along with, that's not a healthy situation either. There's no outlets there anymore. There are a lot of things were taken away that people could use as a coping skill: going to the gym to exercise, even going to the mall to do a couple laps, or go out to buy a shirt. All of that, the things that people enjoyed, at least in the beginning, it was all kind of shut down. We were forced to try to find ways within our own little family unit, or even if you lived alone, to try to do some self-regulation on your own. And it's hard to do that when you have that stuff taken away from you. So it was kind of like the double whammy there. So definitely have seen an uptick in not only eating disorder admissions to the eating disorder units and programs, but also our mental health programs here at the hospital.
Wow. Well, thank you. Now, Juliet and Michelle, from your perspective, what did you see in the schools and among your peers? Did you see more of your friends feeling anxious, depressed, and, just that feeling of isolation? So maybe Michelle, do you want to take that one first?
Yeah, definitely. I think that the isolation, especially at the beginning of the school year, not being able to have a lot of social events and a lot of school traditions not happening, I think people really just felt the extra stress. And I think it didn't allow us to have a break from the school related anxieties. And so it was kind of, I think it was pretty overwhelming for a lot of students.
You feel that maybe it was compounded, perhaps?
Yeah,
correct?
definitely.
How about you, Juliet? What were you seeing?
Yeah, I think the loss of support systems was really, really key in making people feel very hopeless. But another thing that was really detrimental for students especially is all of a sudden your work life, your student life really permeated into every part of what used to be your home life, because all of a sudden now you took all of your classes at home and like all of your homework was at home, all of your activities were at home. So all of a sudden it became very difficult, I know, for a lot of my friends to try to separate out parts of their lives, because things that used to be compartmentalized by location, where you go to school and you can maybe do some homework there, and then you come home and you get to relax, suddenly was dissolved. And a lot of it happened in the exact same place. So I think that, in combination with the loss of support systems, but also like mentorships, like talking to teachers and getting help through that way, there were a lot of things that used to be sort of taken for granted that were very easy to help you de-stress and talk to someone who you might trust or who's a friend, that all of a sudden all of those things were lost, which I think made a dramatic difference.
So I guess my question is, did all this extra stress, anxiety, did that lead to kind of like, other conditions? So like eating disorders, for example. So, I mean, Kathleen, in your professional opinion, is there a connection between, stress and, anxiety and eating disorders?
Yeah, so absolutely the pandemic led to an increase in eating disorders for the reasons that you mentioned, but also because of, the food insecurities at the beginning. People were at home, gaining weight, losing weight. A lot of our patients report that they were home, so they began an exercise routine that then got out of control. So they were over exercising and losing weight at home. So, and to Michelle and Juliet's points, everything was at home. So there wasn't the separation there, right? They couldn't go to work and come home and have a safe place to relax. Everything was compounded in the house. And with regard to the depression piece, the other thing the eating disorders patients have been reporting over the last, I'd say probably more so at the beginning of the year from last year, was a lot of grieving over the loss of their prom or their graduation, which triggered a deep depression for them. And then with anxiety disorders and with depression, as well as schizophrenia, bipolar, and other mental health issues, eating disorders always a secondary chance that you're going to have a secondary diagnosis of eating disorders, which is also a mental health diagnosis, but it never really ever comes alone. Usually comes along with an anxiety disorder. Sometimes comes along with anxiety disorders and depression, like along that spectrum, but it's usually comes hand in hand. The patients are using the eating disorders as a way to obtain control over portions of their lives to reduce some of that anxiety. And they use some of the eating disorder behaviors as a way to self-soothe some of the stuff that they have going on. So, for a patient who has an eating disorder, that purging behavior could be a way to self-soothe and get some of that anxiety out. So yes, they do come hand in hand. And we have definitely seen an uptick in admissions in the eating disorders from many different aspects of the pandemic. It's really, it's just wildness. I think at the end of all of this, when we sit back and reflect, I think the area that we're going to see the most uptick in need for is the mental health issues. And it's going to be an interesting year or two moving forward. And that's across the spectrum from adolescent to adult with regard to where this pandemic has left people in their mental health overall.
Yeah. Wow. Thank you. I mean, that's amazing, and yet disheartening to hear that there was such an uptick among our student population. So I know, Juliet, earlier you kind of shared with us, some of the things you were seeing in schools, but what, if any, personal experience did you have at that time with, any anxiety or depression? And out of everything you were seeing, what did you consider the major stressors in your high school experience to be?
Yeah, I think one of the biggest things that was very stressful, that I think engendered a lot of hopelessness, was just looking not just at the world around us, because all of a sudden we couldn't see friends while all the distractions were gone, but also looking at the wider world and seeing, the fact that so many people were dying, and the fact that a lot of things that used to feel so reliable no longer felt as reliable as they always did. I think that definitely was a major stressor because, you know, a lot of students are sort of coming of age and they're looking to the wider world and becoming more aware of things beyond their own little bubble. So to be doing that at the same time that things sort of seem to be crumbling, or, you know, there's sort of a mass grief going on as all of us are experiencing this same, you know, terrible event. I think that was one of the biggest things, especially early on, that was very difficult to deal with, because I know people often talk about being a teenager and growing up. It's already very difficult and learning to sort of find your place in the world. So to be doing that at the same time as like the entire world is sort of trying to do the same thing, I think that definitely was very stressful. And for me and my friends, that caused a lot of, you know, sort of hopelessness and a little bit of despair, because it sort of feels like there's no path forward. There's nothing really positive to come out of the future, which can cause a lot of very depressive feelings and thoughts.
So, and forgive me, just to clarify, what did you feel the major stressors were in your high school experience?
Yeah, I would say probably the culmination of having a bunch of the same assignments and tests and schoolwork while looking around and seeing the news and seeing like death tolls rise and a lot of chaos, things like that. So sort of like the incongruity of both events, feeling like your life had to continue and all of your deadlines and stressors and all of those things never really stopped or paused. So you never really had a moment to process anything. But at the same time, it felt like there are really big dramatic life events going on around you. So I think the sort of dichotomy between those two events was definitely one of the most drastic and stressful events, at least in this past year.
Yeah. I mean, Michelle, would you agree with that?
Yeah, definitely. I would also say that the pandemic, with a lot of things being canceled, like academically as well, this past year has felt like you're doing everything you can to complete the things that you have to do with not a lot of options or help. Like I know a lot of testing that I had to do in the past year, like so many things were canceled. And so it kind of feels like you're cramming really last minute. And I think that also added to a lot of student stress.
Yeah. So how did the isolation then caused by the pandemic really impact, do you think, the mental health of you and all those around you? So why don't we go to Michelle and then we'll go back to Juliet.
Yeah, definitely the isolation. I think that it just, I think like it just brought everyone's mental health down. I know that was said before, but I think not having that social aspect, not having people to connect to like face to face, obviously you can text, but it's like a different forum.
Yeah.
And I also think that the isolation allowed students to delve deeper into social media, which I think was a pretty bad aspect in this past year. I think stuff like TikTok has gotten really huge. And I think part of that was because of the pandemic, everyone's at home on their phone isolated. And so the social media like was supposed to be an escape, but I think it kind of had a negative effect. And I think you could see that a lot with the rapid growth of eating disorders you see in students.
Oh, yeah, good. I mean, good points. Juliet, how about you? What are your thoughts?
Yeah, I think the isolation, one of the biggest things it did was just make it more difficult to have all of these social connections that are usually so powerful in like lifting us up and helping us get out of, you know, mental health slumps and things like that. So instead of just seeing people in the hallways or seeing people in activities, you would actually have to like reach out and make a text, make a call, things like that. And if you're already sort of feeling down or if you're already feeling hopeless, it's a lot more difficult to go the extra mile and reach out to someone else. So I think that was one big thing. And yeah, so I think in general, the isolation really put more burden on each person individually to take the initiative and reach out and talk to other people. And so when things are already so difficult, that feels like one more responsibility that you have, which is like to keep in touch with friends, to check on everyone else, all of those things. So that definitely had a negative effect, as we've mentioned.
And thank you both for your perspectives. I think it's definitely, definitely helpful to hear what students went through. It hasn't been an easy year, that's for sure. So Kathleen, then what should teenagers do if they are feeling this way? Like, what are some healthy ways to cope? And, how and when do they get help?
So, Juliet brought up a good point. I kind of want to touch on it, and it does answer this question too on and actually Michelle did too, with social media and with the news feed that was going nonstop for probably, I don't know, 3-4 months last year, with the death tolls and the things that we were just bombarded with on social media that was following up to those news feeds. And to your point about social media, Michelle, about people looking to see what other people are doing, and the comparing, and trying to live up to other people, what they're doing. We talked about this at the last session, that all of this stuff does make someone who's already at home feeling poorly about themselves, who may be struggling with a mental health issue. I think it compounds that to make them feel even less worthy, less isolated. I'm watching so-and-so on TikTok and they're out with their friends and I'm stuck here at home. And with the news feed and social media, the other piece to that, and I think this is one of the diagnoses that we're going to see spike after the pandemic clears, is you don't have to be involved in a traumatic incident to suffer from post-traumatic stress. Sometimes just watching that on the news and watching that in social media is enough to trigger post-traumatic stress disorder, PTSD, in someone who watches it. So my best advice, since you both brought up similar things, is if social media is triggering you or the news is triggering you, you got to turn that off. You have to limit your time on the computer, limit your time watching the news, limit your time on social media, and then develop healthy coping skills around that, right? So turn the TV off, turn the computer off, find something that you enjoy doing to break that cycle. So whether it's reading a book, drawing, doing artwork, going for a walk, journaling, what can you find that helps you to relieve some of that stress and anxiety, to put you in a better place, to put you in a better frame of mind? I like to do artwork. I like to read. I'm not a big journal fan, so I know that doesn't work for me. I do like to go for walks. All of those things help me to relax and let go of some of the stuff that has stressed me out over the course of the day. If I am watching something on the news, because we're all in that moment for the last year, we've been in this heightened moment, this heightened stress, I will turn the news off. I will turn off Facebook, and I will avoid the social media, because you can feel it. You can feel yourself starting to get upset, starting to feel that anxiety, that tightness in the chest. You got to take yourself away from that stressor, and you got to find something healthy on the other side to do to help you relax.
Now, so let's say they, students implement all of these healthy coping strategies that you're giving them, and, that's not working. So how and when can they get help? So can you maybe share that with the audience as well?
Sure. So, obviously, I said this at the beginning, right? So there's stressors that everybody has in their life. We can't fully avoid stress. There's going to be deadlines at work. There's going to be due dates for schoolwork. You can't avoid those things. And people will describe that they work a little bit better with a little bit of stress in their life. Most people would say that when they're given a deadline, it gives you focus to get it done. When those stressors compound and you start to have continuous symptoms of stress, or it moves into an actual diagnosis of anxiety or depression, which you would have to go see a psychiatrist to be diagnosed with. But how you're getting to that point is when it's affecting your ability to function in your normal daily activities. So you have so much stress that you've got that deadline, but you can't sit yourself down to be able to start working on it. There's memory fog and forgetfulness, confusion sometimes. Like people can get confused because their mind is going over 30 different things that they have to do that they can't focus on any one item. You're starting to have physical manifestations of anxiety or stress where you have the GI problems, where you're having heart palpitations, you're having sleeping pattern changes. So you're oversleeping, undersleeping. These are all things that, if your normal coping skills that get you through, quote unquote, normal stressors, your school deadlines or your work deadlines, if your normal coping skills aren't working anymore and you're feeling those physical manifestations, then that's at the point that you want to reach out to a medical professional. So that may mean starting with talking to your primary care doctor. And, sometimes that's all you need. And they may be able to help you get connected with a therapist or with a group that can, the support group that can help you. Or it may mean that you need to actually go see a psychiatrist or a doctor who may need to help prescribe you something to help alleviate some of those stressors. But there's a lot of things out there that you can do. So there's doctors that can provide medications. There's support groups that are available in the community. For those of you guys that are in school, you have guidance counselors and you have teachers that you can talk to, and reaching out just to your friend group sometimes helps to get that off your chest. But if it's truly to the point that you can't manage and alleviate it, that's at the point that you want to seek medical help for it. At least get a referral to possibly sit down and speak to a therapist.
Okay. And thank you for sharing that with everybody. That's really important because I know, after trying certain strategies that might not work, people are like, well, what do I do now? So Juliet, how do you typically cope with stress?
Yeah, so personally, one of the first things that I'll do is just try to organize my thoughts, organize my to-do list, things like that, and really take away the foreboding sense of doom, just like the idea that there's so much going on, there's so much to do, everything's so stressful, and really trying to enumerate it and put it down, have it a little more manageable just because it's all right in front of you. So you have a sense of what actually needs to get done, what's less important, what can be pushed off, things like that really help at first. But if it's like a deeper sense and it's more from within myself and not really my circumstances, but more just the fact that I am feeling very anxious, I will try to definitely disconnect. That's one of the first things, is try to get away from everything for a moment. Usually I like to listen to music, maybe talk to someone. That usually helps a lot. If I have the time, I'll try to read, but that's not always possible. So definitely just trying to disconnect for a moment, quantify the problems, understand that what I'm facing isn't impossible. And no matter what, the next day is going to come and the day after that, and, everything will eventually be resolved one way or another. So typically just disconnecting is my first step and really helps a lot.
Great. Thank you so much for sharing. So now, Michelle, how have your teachers and school nurses helped to alleviate some of these school-related anxieties? What did the schools, or how did they respond this year?
Yeah, so I'd say that the biggest stress and anxiety relievers that my school has implemented are ones that have given students a break. And so, like, for example, this past year, they designated days that would be considered the mental health days. And they weren't originally chosen to be days off, but they gave it to us anyway. And the days were they were pretty nice breaks. They either gave students a time to just disconnect completely and spend a day not worrying about school, or it was a time for students to catch up on their work, which I also think was a pretty good help. When the work becomes overwhelming, sometimes you just need more time. And then I'd say that another really good thing that they've done is this past year, they brought in food trucks. So a couple of times during the year, they would bring in a food truck. And it was just a really good break from the normal school day. It was exciting and fun, and students could go out and just enjoy some time with each other. And it was really helpful in just taking students' minds off of everything else. Another really great activity that they implemented, which I think was a student initiative in the past, they brought in dogs. So during breaks, students could go and see the dogs, and it was just another really nice time for students to decompress. And then I'd say for teachers, the biggest thing that they've done to help relieve stress is to just be flexible and open to listening to students' needs. I think sometimes teachers are also really caught up in, oh, I have to teach this by this deadline. But I think by them really listening and understanding that sometimes students need a break, students need deadlines to be switched around. I think them being flexible is really, really helpful.
Great. Well, I'm glad to hear so many nice services have been offered to students. That's really comforting to know, because you're absolutely right. In those times, you know, it's as Kathleen has mentioned, it's very important to take that step back to decompress. So what suggestions do you have for how others can help teens who are feeling anxious? So, you know, like peer-to-peer, right? You're seeing one of your friends being very stressed out and, you know, maybe, you know, not acting like themselves. So what advice can you give to others on how to help them?
I would say the best way to help is to listen and to be ready to advocate for whether it's your teen, if you're a parent, or for if you're a student, like for your friend, maybe advocating like for them by being with them to talk to teachers if they need help that way, or advocating for them and getting them professional help. I think that's really a good way to help teens. And then I'd also say to let the teen know that they're not alone in their experience, that you know, that you're going to be there to help them, you're going to be there with them every step of the way, and also that their experience isn't something that's out of the norm. Like they're not alone in that, and that being anxious or depressed isn't something to be ashamed of, but something that, you know, you can really get help for, and it's something that together that you guys can overcome.
That's great. Thank you for those suggestions. Juliet, did you want to add anything, or you have any different suggestions? I know it's not always easy for peers to approach other peers to ask them to share their problems and their challenges. So do you have anything you would offer to your you know, your other friends or other students?
Yeah, I definitely think it's difficult sometimes, especially when you're in quarantine, to really show that you were supporting someone else, that you were there to be, you know, if they wanted to talk about anything, that you were there, that you wouldn't judge them. But I think definitely one of the first things to do is to make it very clear that, you know, you're available to talk to if they want to rant about anything, if they want you to help them, you know, you're definitely there to support them. I know one thing that we did was whenever someone in our friend group was feeling really, really stressed, we would all drop by and like leave a little gift at their house and just sort of show that, you know, it isn't always, people aren't always ready to talk about it. People aren't always really willing to discuss everything that they're going through, but sometimes just showing through little acts like that, you know, dropping off snacks, things like that, that no matter what, you're there to support them, you're thinking about them, and sort of knowing that there's people that have your back is always really comforting.
Thank you. Thank you for sharing. Now, Kathleen, I'm going to switch this on you. Now, it was very comforting to know and to hear some of the things that Michelle had shared her school was doing. But, you know, again, typically, you know, what advice can you offer to schools, to teachers and school nurses? Because I'm sure school nurses are probably, you know, on that front line seeing, you know, students come in every day with, you know, issues. What advice can you offer them to kind of help alleviate student anxieties?
So I think Juliet, talking about the mental health days that the school gave, all of that was great. The one thing that she said that, really interested me was that the teachers in her school were able to recognize that they may need either an extension on the due dates or, a break from the assignments because of juggling other course loads. I think and maybe the pandemic forced teachers to reflect on this, but my child did online learning as well last year, and I had a similar experience with her with regard to teachers being willing to shift stuff around because of due dates. That I think there was more of a acknowledgement and a recognition that that teacher isn't teaching in a silo, that there's, however many other classes that their students are going through, that they're also getting assignments for, that I don't think we had pre-COVID. So I'm hoping that moving forward, there's some sensitivity to the fact that, one teacher may be giving a, 9-page paper in one class when another teacher is giving a 9-page paper in another class. Just being mindful of the fact that, this isn't the only subject that your students are taking, that there's other classes they're taking as well, which those teachers feel the, class is just as important. So they're compounding all the homework. I don't know. You'd have to ask the two young ladies on the call with us, but I do think that there is a little bit more acknowledgement with the online learning about the assignments. And I think it's because all of the stuff was submitted through the schools first. So they looked at everything that these teachers were putting through to be due. So with that said, that would be my, I can't control what they do in school, but I do think that that makes a huge difference. Because when, put yourself in a student's shoes, I couldn't even imagine going back there and getting handed 8 assignments from 8 different teachers with the same due date, with the, massive projects or long, papers that are due all at the same time. So, when you see your students begin to struggle with the course load work, right? Like we all have only so many stressors or tickets to ride, as I call them, in our psyche that we can handle, being compounded with stuff after stuff after stuff before that stress and that ability to hold it on our shoulders before we crumble, before we're not able to do it anymore. We all have a wall that we're going to hit. It's just a matter of what our threshold is. Some people have less tickets, and some people have a lot more. Some people have less tickets, but they hide it really well, that they can't handle it, and they internalize the stress, and that's where those stressors start to affect their physical well-being. So for the school nurses, my advice is, if you have, and this is really not even just high school students, this is students from kindergarten on, stress manifests itself in a lot of different ways depending on the age of the person you're looking at. But for the school nurses, if you have students who are frequent flyers in your office with complaints of headaches and stomach aches and generally not feeling well, or fatigue, or you notice students in your classrooms or friends that you hang out with who are starting to pull away from you, starting to isolate at home, their grades are changing, they're hanging with different peer groups, and you could be possibly looking at a child who is dealing with, stress that's manifesting into a mental health issue or a mental health issue, a standalone one, that this is how it's manifesting. But from my viewpoint, I think, students do a good job these days advocating for themselves with what they're able to do. And as a school professional, I would encourage you that if your students are advocating with you that they've got too many stressors on their plate at that moment, that you listen to your students and you try to negotiate some changes with them with regard to due dates and stuff, or with changes to projects or things that are due, to try to help them manage their stress levels. Because I did see that in the last year, and I do think that that piece of it has made a bit of a difference.
I think you make some really good points about, general observations of students and not only physical physical symptoms, but also maybe even some of their behaviors. I know it probably may be difficult for school nurses to kind of screen for mental health illness, but certainly through observations and perhaps even conversations with teachers, to kind of help those students get, the assistance and services that they might need. So, thank you for bringing up those points. Now, speaking of that, now you brought up, okay, you identify a student that, may need some assistance. Okay, so then what do you do? So can you maybe share with the audience, like, what are the mental health treatment services that are available for teens with anxiety and depressive disorders, and what services are also available for coping with eating disorders? Because you mentioned that earlier this evening as well.
Sure. So mental health treatment, there's a wide variety of ways to seek care. If you do think that you are suffering from anxiety or depression that is, consistent and altering your ability to just function in your normal everyday life activities, whether it's school, work, or even at home or socializing within your friend groups. You can reach out to your primary care doctor, and oftentimes that's where a good portion of patients start. They go to their primary care doctor and describe, physical symptoms of what they're having, and delving a little bit deeper with the doctor, realize, it's not just the physical symptoms. I'm also, having trouble sleeping, and I have a tightness in my jaw, and I just never seem to be able to relax. And then it's at that point that usually most doctors, there's like an aha moment that it's probably more stress related, particularly when they, begin doing some testing and they realize that there's nothing physical going on. It's most likely manifestations of anxiety and depression, which do have a lot of similar threads and symptoms, both illnesses. If the primary care doctor is unable to manage what's going on with the patient, the next thing that they could do is refer to a therapist to get individual therapy. Our hospital here has support groups for families, for patients. Most local hospitals do have support groups for mental health issues. Seeking out a therapist for individual therapy, family therapy is usually part of the treatment. And then if you're in, the midst of a really serious mental health issue, if even that interventions doesn't work, then a psychiatrist may be an option, where you can go talk to the psychiatrist in conjunction with therapy, and possibly medications may be needed to be prescribed to assist you to get your mood and your overall stability back on track. And, obviously the last level of care for patients who are suffering from serious anxiety and depressive disorders would be either a outpatient type service like we have here, which is partial hospital programming, and IOP. So PHP is a 5-day-a-week, it's about 5 hours a day program, and IOP is 3 days a week, half-day programming. And then last highest level of care would be inpatient treatment for stabilization.
Wow. Okay. Well, thank you. Lots of options for students and lots of options for parents as well. So thank you. So I just want to be mindful of time, and I wanted to make sure we give our audience an opportunity if they have questions to ask our panel. So I'd like to open it up to questions and answers from the audience. Again, if you do have a question, please post it in the Q&A section of the webinar so we can pick that up. And let me see, oops, we do have a few posted already. So our first question is, what would you say that the mental growth of high schoolers and or adults was affected by anxiety, depression? So what would you say that the mental growth of high schoolers and or adults was affected by anxiety or depression? So I'm gonna, I think, turn that one to Kathleen.
So mental growth, what's that?
Would you say that mental growth? Sorry, would you say? I
guess I would frame it more of maturity and growth. I I definitely feel like with the limited socialization, particularly that the younger adolescents and young teens had over the last year and a half, I think there's going to be some lags in some of the maturity levels and the mental growth, to use the term that was used. I think we're going to see some lags in maturity and development. Part of adolescence and part of high school years is learning how to socialize in relationships as you mature and become an adult, whether that's dating relationships or forming and bonding relationships with peers, and learning how to negotiate through some of the highs and lows of being in a social group and in a relationship, to the drama of it or the non-drama of relationships. We practice that as teenagers. That's part of normal growth and development. And isolating at home during COVID and missing out on some of those milestones that adolescents are given, like prom and dances and the ability to partake in sports and extracurricular activities. I definitely think, I know, because I see some of it on my own unit, that we are going to have some social maturity issues on the other side of this. There's definitely milestones and things that were missed.
Yeah, definitely, for sure. So our next question is that it seems that some kids withdraw into the video game world in order to manage their anxiety by retreating into an alternate world. During this time of isolation, it may have felt better than needing to interact as they normally would at school. Now that things are opening up and schools may be in person in the fall, what advice would you give to help these kids re-enter and manage their anxiety?
I'm assuming this one's for me.
Yeah, you know what, how about this? We'll start off with a professional perspective.
Okay.
And then I'm going to flip it a little bit for Juliet and Michelle. So why don't you start, and then we'll go from there.
So there is such a thing as, video game abuse. There's no question, and social media addiction. So, we didn't even touch on that in this webinar, but it's a thing, not necessarily diagnosable. People aren't diagnosed like they would be with a substance use disorder with video game disorder, but it is a thing, in that adolescents, young adults spend more time on electronics than they do even in self-care, like taking showers, to the point that it mimics an addiction. So they're not eating, they're not doing their normal functioning because they are so addicted to playing those video games or having that online time. So obviously, with the pandemic, this has exacerbated this whole phenomenon. So as my advice, as with any other addiction, you need to stop. If it's getting to the point that you're spending that much time on social media that it's affecting other things, you need to make a conscious effort to stop the thing that is causing the disruption. So I would set timetables for yourself. I would give yourself, I'm going to give myself an hour in the morning, and then I'm going to shut everything down and I'm going to do something else. You have to pick a hobby, pick a coping skill, pick something that you enjoy. And when you shut that off, you're going to do that. It's really about resetting your priorities and resetting what you want to do to start to re-normalize your life, getting back into doing normal things. With the plan, and I would start now with the plan that September school's going to be back in session in person. So you need to prepare to get yourself back there now, and then work on it through the summer. But it's a good question. And as parents who are listening, because I'm not sure if that came from one of our adolescent or one of our parent viewers, as parents, setting those limits with your children, that this is the allotted time that you are allowed to have on social media or on video games or any electronics. And then you need to stick and stay firm to that, because if you're going to set a limit, you have to follow through. If you don't follow through with those limits, it's going to be it's a self-destructive process. It's not going to work. It has to be a team effort between you and your child. you come up with an agreement together, and then you and that child need to stick to that. That's the, easiest way to get it going and start now, because it's going to take some time. And I'm a parent of a male, so, and not that only men play video games and boys, but I can tell you that this is an ongoing discussion in my own home, with my teenage son. So yeah.
No, definitely. So, and thank you for sharing that perspective and the advice for the teachers. Now, I kind of want to flip the question a little bit, to get the student perspective, because again, as a parent of a teenage boy myself, and as a working mom, sometimes they could go on, on the video games when you're not home. And so other students, and I don't know what Juliet and Michelle you've seen, some of them have just been going to their room and sleeping most of the day away. So how would you want your parents to help you re-engage in, positive and healthy behaviors to help you transition back and help to prepare you for the upcoming school year? So I guess let's start with Juliet, and then we'll go to Michelle.
Yeah, I would definitely mention, like, absolutely from a student perspective. One of the key things that is so alluring about a lot of video games, particularly I know a lot that people my age tend to play, is that it is a pretty social activity, especially if it is obviously a multiplayer game. So a lot of times it is sort of like hanging out with your friends. So I know during quarantine especially, a lot of my friends got way more into video games than usual because it was a chance for them to sort of bond, do an activity together where everyone could be involved that didn't feel like it was, worse because of the pandemic. It felt like it always did. And also the fact that sometimes it does sort of act as like a hobby or something that is fun to do with your friends or fun to do to de-stress. I know a lot of the games that are sort of not necessarily repetitive, but like very, very task-based, very mission-based, things like that can be sort of soothing in the way that it doesn't take a lot of concentration. It doesn't really feel like you're going to fail, but it still sort of engages your brain. But in terms of transitioning off of that, I do think encouraging students and like high school age kids to find what they loved about video games in the outside world. So if they love, playing with a big group of their friends and having that camaraderie and sense of success together, then you can have the same experience, but just, outside, whether it's like playing a sport or doing some sort of activity together. A lot of the same benefits that you get from playing video games and from, being online, you can still get from the outside world. It's just sometimes video games are a lot easier, or they're a lot more accessible, or they give you something to do. So from my perspective, it's sort of like, there are, I think, positives of playing video games and being able to have a social experience with your friends online, but there's definitely a lot of benefits also to transitioning that to a more in-person platform, especially now that it's a lot safer and people, are going back to school and things like that.
Great, thank you so much for those suggestions. Michelle, did you have any additional thoughts?
Yeah, I'd say for a parent, to just observe your kid, and I think, like Juliet was saying, like video games may not always be a bad thing, but ensuring that like the friendships that you have in a video game setting are also present in like your real life. And so I think if a parent can encourage like, okay, like let's reach out to your friend, or let's go out and do something instead of just having that friendship over a video game, I think that would help to transition a student from the pandemic world to kind of like the re-entry phase.
Yeah, no, definitely. And I'm going to combine a couple questions here next. So, one of the questions is, could we speak to the impact of online schooling and the lack of social contact, which you all have kind of mentioned, right? And then how can parents help their, their middle schoolers? So that's kind of, if there's any additional thoughts on that. I don't know, Kathleen, if do you have any additional thoughts of anything that we haven't hit on in terms of the impact of online schooling?
I think just to echo what Juliet said and Michelle, right, for even the middle school age, we try to re-normalize what friendships mean. And you both brought up a good point that you can do multiplayer video games, right? So you have your friend connections through the video games, but now it's time to make those friend connections, but in the real world, to, you know, get back to having friends over and going over to friends' houses, going to families' houses, getting your middle schoolers out of the house and re-normalizing their social circles with their friends or community or families is important to, you know, I think that's the best thing we can do at this point. To get them back on track in a more normal, that, to use that word, normalized setting, is the best thing that we can do. Yeah.
So now, knowing that there has been such an impact on students, right, with online schooling, what can, again, coming back in the fall, right, the expectation may be, oh, well, we're going to go back to pre-pandemic. So what can the schools do to, assist students get back into that swing of things with those expectations? What would you say to the schools, school teachers, and or even the school nurses? So I'm going to actually go for the student perspective, and we'll start with Michelle this time to try and answer that question.
I'm sorry, could you just repeat the last part of the question?
Sure. So knowing that, when students are going back in the fall, they may want to go back to pre-pandemic type of a scenario. And so what can schools, be it teachers, school nurses, what can they do to kind of help transition students from that online schooling mentality back to the pre-pandemic mentality of in classroom, go, go, go? Because you remember, you just talked about it being very flexible during pandemic, and there's things to be considered here. So from a student perspective, what can you recommend to the schools?
Yeah, I definitely say to make that keep the flexibility. I definitely say that's important, whether you're online or in person. I think being understanding that the students are coming off from an online perspective, and I think making that transition kind of smoother. But I'd also say for the school in general, implementing some of those in-person traditions would definitely be helpful. I think it allows students to be really immersed in the in-person learning aspect, and maybe more willing to interact in a classroom setting, and to not be kind of in that Zoom mentality where you can turn off your computer and you can get distracted. And so I think trying to just find a routine or some kind of normalcy where, if you remember something that you did pre-pandemic, like some kind of something that you do at the beginning of class or something like that, bringing those back and making sure that there's a sense of tradition and normalcy.
Great, thank you. Do you agree, Juliet? And do you think they should bring back some of those in-person student activities?
Yeah, absolutely. I think it's been mentioned a couple times is sort of the leniency and the understanding that a student has a lot of different things going on. And I know Kathleen mentioned how during the pandemic and during quarantine, teachers really began to acknowledge the fact that there were other classes and trying to work together, things like that. So I think interactions like that moving forward are definitely still possible, and I definitely encourage, because I think it improved the overall student experience. But another thing that I'm not sure if we brought up yet is the fact that when we were doing Zoom school and meetings and things like that, I think it really damaged a lot of students' attention spans. It was really, really difficult to focus. And I think as we transition back, I think that'll be one of the first things that both students and parents and teachers will notice, because we got really used to multitasking, doing homework while being on Zoom, while doing other things and listening to music. And so I would say in a classroom environment or trying to engage, having very, very interactive, very social, discussion-based things like that are going to be probably a lot that'll be foreign after such a long time, but I think it'll be one of the best things to draw students back in and really feel like they're present in a classroom and they're not doing 18 things at once and they're not at home anymore. They're part of a community and they're trying to learn and be part of a group. So yeah, I would say the interactive things that Michelle mentioned and also extending that back into the classroom.
Great, thank you. Wonderful suggestions. Thank you both. So I'm not seeing any other questions in our Q&A section. So if we do not have any other questions, I'd like to thank you all, and this will actually conclude this evening's webinar. Again, thank you for joining us for a very informative conversation. Please remember that the opinions expressed here by our medical expert are not a substitute for medical advice from your own physician. For more information about Robert Wood Johnson University Hospital Somerset's Behavioral Health Sciences or Eating Disorders program, please visit www.rwjbh.org/Somerset or call the RWJBarnabas Health Behavioral Health Network Access Center for 24/7 mental health support at 1-800-300-0628. On behalf of Robert Wood Johnson University Hospital Somerset, the Somerset Healthcare Foundation's Youth Board, and Friends Health Connection, thank you all for joining us this evening. Be safe, be well. Take care.